as well. Thanks so much for coming. I'm Olivia Bellis from the GLA Community Engagement team, and we're going to give you a bit of an overview of a piece of work that we've done called the Map of Community Views. So we produced this map to highlight some of the insights that communities were sharing with us between April and September last year, and the impacts of COVID-19. So I'm going to start to share my screen. You're also going to hear from Melissa, who's in the team, so she's somewhere here, and also Mike a little bit later, who'll talk a bit about the kind of the visualizing and the design aspect as well. And then we're going to have, right at the end, some time for questions from all of you. So please do put them in the chat, and hopefully you can see some slides now. Is that all okay? Yeah. Hopefully, I thought I switched off all my notifications, but who knows? So sorry if there's some like dinging in the background. Hopefully it won't be too distracting. Okay, so yeah, I wanted to sort of kick off a little bit talking about our team first, just in case some of you don't know the work that we do. So we've got here on the right-hand side this kind of bridge between Londoners and City Hall, and that's how we see our team's work. So really that link, bringing insights from Londoners in partnership with them into the organisation and into different policy teams, and then obviously the other way around. So policies and programmes, connecting them back out with Londoners. And they're around three sort of core areas. So working with civil society and strengthening civil society. There's a focus on faith, engagement, and lots around community participation, and really interested in those ideas around citizen engagement and different ways of decision making within communities. So I hope that gives just a bit of a kind of overview. You'll see on the left side our kind of three core objectives, which I've kind of really kind of summarized there in the three areas. But yeah, that kind of idea that civic voices will be strengthened through our work is really at the core. And we're really interested in lived experiences and how that influences change. So really our team's all about the power of human stories. So that's really at the root of the map. So I'll just take you on to a bit, we will go into the insights from the map, but a little bit like why? Why did we start this work? Why did we reach out to these groups? So you'll see from these news headlines, they really demonstrate that from early on, we knew that the pandemic was having a disproportionate impact. And what we really wanted to do was find out what people were experiencing on the ground and hear from them firsthand. So throughout that period, April to September in 2020, we carried out 21 roundtable meetings, which was engaging overall with about 250 people. So these roundtable meetings were hosted by our Deputy Mayor for Social Mobility, Social Integration and Community Engagement, that's Dr. Debbie Weeks-Bernard. And what we did with those roundtable meetings, due to our team's remit, as I mentioned, is really focusing on the experiences of faith communities and Black and Asian minority ethnic communities. So it was really through the insights gathering that we were also able to pick up on protected characteristics, including age and gender, within these roundtable meetings and conversations. So this just gives you a bit of a snapshot of some of the questions that we asked within those roundtable meetings. We were really keen to have a kind of framework that really helped that conversation. It was very much a listening exercise, but to have this was really useful in obviously then analysing a lot of this kind of qualitative material much later. Something to just flag now is we'll drop in the link, we'll drop in the chat the link for the full kind of map. So that's actually available publicly on the data store at the moment. And what's included in that is not only the insights we're going to cover in a moment, but the detail around the questions, the detail actually around those 21 roundtables, who we engaged with, and when. So I'm going to move on now to the map itself. So this is the kind of the big picture. So through all of those conversations, this is where we got to. And yeah, we really chose this format as it outlines the interconnectedness of many of the issues that we were hearing. Melissa, would you like to take over from this bit onto the map?
Yeah, sure. So as Olivia said, we chose this kind of circular format as it highlighted the interconnectedness of many of the issues. And as we were doing our analysis, we came up with these two cross-cutting issues that you can see kind of not included in the map because they kind of connect to everything that was mentioned. So there's digital exclusion. So, you know, people who weren't able to get online were unable to access services, unable to share their views, whether adults or children trying to access education. And also representation and discrimination. And we found that in a lot of cases, there just wasn't enough data. Communities didn't feel like they were represented in data collection, and therefore they weren't able to find out about the disproportionate impacts that the pandemic had on their specific community, and services weren't able to be tailored specifically to them, or they weren't able to access things like translated guidance because there wasn't enough information about their community group. We worked closely with Mike in the City Intelligence Unit, who will talk to you a bit later. And I think the map really demonstrates the value of good design and how we can show data, and this is quite hefty qualitative data in engaging ways. And you can see the core areas in the centre: health, information, civil society, safety net, and inequalities. And as we go through, if you can think of any actions or sort of things that you could do now that you've seen the map, I'm going to paste a link to the Jamboard here. And Jamboard's basically like a live platform where if you click through to the link, and there'll be some questions, and you can basically add what looks like a little post-it, and we'll flag up when you can add stuff to that as well. So zooming in on the first section, which is information, we heard that the lack of representation of certain groups on census data meant that they weren't receiving the targeted support that their language needs were not catered for. Could you go to the next slide, please, Olivia? Thank you. So these concerns were particular to Somali, East and Southeast Asian and Latin American communities who just felt that they aren't captured on a lot of data at local authority level and also at national level. In terms of languages and translations, at one of the roundtables, we had a Pakistani doctor who spoke to us about how important literacy would be to consider when we're producing translations. So as you may know, lots of translations were written and everyone was pushing out as many written translations of guidance as they could, but we were told that much of the older generation cannot read or write well, even in their own languages. So written materials still had to be read out. They still needed that kind of middleman to get the information to them. So as a result of that, we started to work quite a lot on audio clips of translated guidance and sharing videos as well. So the next issue is around inequalities. And we found that generally there were huge issues around housing, overcrowding, multi-generational homes, people renting their properties and feeling insecure and not having any tenancy rights. In terms of homeschooling, parents faced language barriers, they were unable to assist with their children's learning, and there was limited digital access. So we heard from some groups that there may be 4 or 5 children in a home, and there may be only one laptop, and that might be the laptop that the parent has to use for work. There were lots of issues around people actually engaging with homeschooling and home education. Lots of communities were working in non-COVID secure working conditions, or even if they were working sort of within the NHS or the care sector, they had inadequate access to PPE and inadequate access to testing. And an example that really brought this home for us was at the East and Southeast Asian Roundtable, when we heard about Filipino health workers who are having to organise their work rotas based on their house rotas. as many people sort of shared the same room and beds due to the extortionate cost of renting in London. So you would have day workers and night workers sort of sleeping in the same bed due to the high cost of renting. And of course, in these kinds of settings, it's impossible to self-isolate and to avoid the virus spreading through homes and also through workplaces as a result. If we could go to the next slide on the safety net. So when we're talking to groups, we found out that faith groups were really plugging the gap on food provision, and also smaller community groups. They stepped up the most in terms of food delivery to support their congregations and their wider communities, but they were sort of living day to day, really not getting enough financial donations due to the lack of services, and not getting those regular donations in from congregations or through regular sort of donation methods as people were losing their jobs or being furloughed and having less access to funds. So a lot of people were really worried about their organisational survival beyond the pandemic and beyond this crisis moment. There were also a lot of concerns raised about social isolation amongst older generations and the lack of culturally appropriate support. So whether that was for mental health, particularly for older people or younger people, and that not being culturally specific, so not really understanding the needs that people had and being a sort of one size fits all, which ends up not helping anyone. And in terms of a personal story, we heard quite a lot from migrants who are in the trap of having no recourse to public funds. They could not afford to become legal and apply for settled status, but then they were therefore excluded from most other forms of financial support. So they were really having to rely on things like food banks and additional services, and really struggling throughout. If we go to the next slide around health. So this, I guess, was one of the biggest areas that we heard from people on. And as you can see, there's a lot of it focuses on communication and how people engage with the health system. And as we know, up until today, as we're hearing about vaccine take-up, a lot of ethnic minority communities and faith communities have negative experiences of engaging with the healthcare system in the past, and this really put them off in the early stages of the pandemic. A lot of people were not registered with the NHS or GPs, and to begin with, there was a lack of access to testing, particularly for those who were in high-risk jobs and working in high-risk environments. Around bereavement, there was a lack of culturally sensitive support, and there was a real lack of understanding around what was appropriate to do when someone was unwell or when someone passed away from a lot of health services or support services. And we found out from a lot of communities that misinformation has been really damaging throughout, especially when groups have been unable to access the correct information in their own languages. So lots of community groups mentioned things being circulated on WhatsApp groups that have had negative impacts on people's abilities to protect themselves from the virus. And of course, we know the same is happening with vaccines right now. So this was raised by most communities, but particularly sort of African communities, the Somali community, and Pakistani communities were really concerned about this and how much wrong information people were getting through these kind of community groups or family groups. And there's a lack of appropriate carriers of messages. So people were saying, we want to hear from a doctor. We don't want to hear just from someone who's been paid to speak in an advert. They wanted that information to come from someone they could trust. Yeah. And I'm going to hand back over to Olivia, who's going to talk about some of the gaps and absences in the data that we were able to gather.
Thanks, Melissa. Yeah, so basically we really acknowledged through having looked at all of the insights, and it's really helpful to kind of see them in that kind of in the round, really acknowledged that there are some gaps and absences in the data that we've collected. We talked at the beginning around our focus for these roundtables was ethnicity and faith. So the question around whose experiences are missing and how can we ensure that their views are represented was also something really, really important to us. And actually what we'd like to do towards the end of this session is maybe kind of use a Jamboard and get some ideas from you around things that you think could, gaps to identify basically that could be incorporated within this. So some insights on other protected characteristics did come through. There is a gap in the narrative of this specific piece of work around the impact of COVID-19 on disabled Londoners. This is addressed in like wider insights we gained through the Rapid Evidence Review, which was commissioned by the GLA and through University of Manchester. There's also a lot of work taking place across our communities and social policy unit and within the social integration team, with a particular focus also on refugees and migration as well. There were organisations representing disabled Londoners at the roundtables through the Bangladeshi roundtable, for example, and who work with vulnerable adults, disabled children and children with learning disabilities were present through the Bangladeshi Parents and Carers Association. That's just an example there. There was not a roundtable focusing specifically on age. However, many community organisations outlined the difficulties faced by children and the elderly, particularly the elderly, suffering from loneliness and isolation. And again, the same, nothing specifically focused on gender disparity, but many issues affecting women were highlighted by women's organisations during the roundtable. So women facing additional pressure as primary carers, facing domestic abuse, fearing access support due to no recourse to public funds, and the lack of clear information in community languages was also highlighted as well. So yeah, I mean, again, we just go back to these other sources of data that have been really helpful and that we like to present, I guess, alongside this map. So we mentioned the Rapid Evidence Review there. Again, in the actual full kind of map report that's online, these links are all available in there for you to kind of have a look at if you haven't already seen them. And then there's also the London Community Response Survey, which is something, again, that the community engagement team initiated early this year as a weekly questionnaire, which has now just gone to monthly, really just trying to understand the current picture of civil society organisations in London. So these are all really useful data sets to look at alongside the map as well. In terms of, slide. Yeah, so this is a slide sort of talking, I guess, about the sort of the impact so far of the map and how it's influenced our work and the work of others. So just to give you sort of a reference on sort of time, we finalised, you know, it was April to September that we were essentially gathering and holding these roundtable discussions. We had a period of analysis that followed that, and then it was basically Christmas time that the map itself was produced and shared directly back with obviously everybody that was involved in the roundtables. But then also we've started to kind of use opportunities like this to make sure that this information is being shared so that it can be used in different ways to inform different pieces of work. There's more, I guess, that could be coming from this, and we really want to track that and hear from those that have been using it in different settings. So, but just to kind of highlight a few things here of how it's linked across that we know of. So the translations was a really big part of this. There were loads of concerns raised about the format of translations and the limitations of written translations in terms of, just general messaging. And as Melissa was saying, kind of to tackle misinformation as well. So we've been working with our social integration team and marketing team. These insights were used to develop a whole series of kind of new translations, audio clips as well, to really target those communities that needed it most, and also the development of a language hub which sits on the london.gov.uk website. There was also the links across to kind of specific policy teams. So The housing team was one example. Housing emerged as a particular area of concern during many of the roundtables. And so in November, we worked with the housing team to set up a meeting between community and civil society organisations so that they could have their concerns shared directly with policymakers and seek further guidance. There was also what came from this is, I'll just jump to the public health briefing. So a number of concerns emerged from the meetings related to engagement with health services and access to this public health information. So beginning in November 2020, our team have been hosting public health briefings for communities and civil society groups with Public Health England. So Professor Kevin Fenton has attended and contributed to all of those. So they're monthly, and we have around kind of 200, 250 people attending those as well. So yeah, I think I'll kind of leave that there for now, and I think can pick up on any of those other sort of impacts and actions so far if anyone has any questions on those in the kind of chat sort of section that we'll have later. So yeah, please continue to put any comments and questions in there. But I think now might be a good time to hand over to Mike, and Mike works in the City Intelligence Unit within the GLA, and we work really closely together to produce the map itself. So Mike.
Hey, thank you. So Olivia is still steering this screen, so I might have to do a bit of next slide, please. Chris Whitty, start. So I'm Mike Brondby. I work in the City Intelligence Unit, working on data visualization and sort of information design. And so next screen, please. So we work on things like this broadband connectivity map, where we're showing sort of spatial data and non-spatial data at the same time. Next. Next
slides are a bit sticky. Slides are sticky. Sorry, I'm pressing, no, but doing it. So
it's my fault for putting big images in, I think, probably.
Might need to reshare and see what happens. There we go.
Lovely. So this is, we also make kind of data dashboards, if you like, and this is the sort of population projections dashboard or explorer, where you can access all the sort of our sort of demographic projections of different of the populations in London and different London boroughs. So that's all up on the data store and publicly available, and you can download the data that you find and download the visualizations that you find there. Next slide. This is the London squared kind of small multiples map of COVID cases, basically, that we've been tracking, and is part of our kind of wider London COVID dashboard page. We've got a number of pages on sort of cases and deaths and all sorts of different sort of metrics. But so this is the sort of London squared cases dashboard, and that's sort of an interactive map. We work on things like that, where you can sort of move through different time periods and sort of look at different cuts of the data. Thanks. And then these next two slides, you can sort of click through, basically more qualitative presentations of more qualitative data that we do. And this is the survey of Londoners that was done about a year or so ago, which was sort of taking the temperature of the mood of London and how they were how people were feeling in London, and how they were, what the sort of community cohesion and that sort of thing. So that's the kind of work that we do day to day. Clicking through to the issues map. So when we basically Olivia and Melissa sort of approached me, it was very much at the tail end of their process and all this hard work that they'd done, all this sort of data gathering, and they'd gathered an awful lot of data, basically. And so how did we arrive at this design? To sort of, how did we kind of evolve this design out of the data that they had? So click to the next screen. This is what they presented me, which was kind of everything they'd gathered in one bundle, if you like. And it was like this was the challenge. Is like, okay, we've gathered all these insights. How can we meaningfully and sort of accessibly sort of show this information and make it make sense? Okay, so next slide. So in a design process, we're thinking about what are the problems we're trying to solve here, and the problems we were tackling are: we need to communicate all the issues fairly. We need to show sort of broad relationships between the issues. There's obviously too much to fit on a single screen, so because you can't, there's problems with comprehension of the detail and accessibility. So we need to find a way of zooming in on a subset of the issues. That was quite hard because everything was sort of categorized, but loosely, but not sort of usefully for that purpose. And the text was quite long and sort of unedited at that point. So next slide. Yeah, so when also within a design process, you're thinking about what are the constraints that we've got. So where is this going to end up? These are the questions I had for Olivia and Melissa. Well, is it going to be a static graphic? Is it going to end up in a presentation, as it quite often does? Is it an interactive piece? Is it going to end up in a report somewhere? Some or all of those things. Deadline versus development time. You've got to keep in mind, how long have we got, and how long is this going to take to build? Sometimes we're sort of balancing, reusability versus development cost. So something might take a while to develop, particularly interactive data visualization. But like the London Squared one, where we've shown the COVID cases, I spent a while developing that, but we've used that time and time again because it's a really nice way of compressing borough data, sort of small multiples of borough data. So that was time really well spent. And what's the audience for this information? And then we look at sort of design constraints, like what number of sort of categories have we got? What's the maximum length of text that we're trying to show and get on screen? What's the maximum nodes, like data points we might want to show at any one time on the screen? And what's a reasonable font size to show this in the context it's going to be shown at? So next slide. And I really like this quote by Moritz Stefana after Marie Kondo, which is data visualization is the art of tidying up, and particularly in information design, that's definitely the case. This is very much the case in this project as well. So next slide. So I basically pushed the challenge back to Melissa and Olivia and said, okay, if we want to be able to zoom in on some of this data, we need to create these sort of broader top level categories. We've got lots of sort of smaller subcategories of these issues, but how can we create a broader sort of broader bubbles for them to sit in and broader umbrellas for them to sit under, and also bring those issues together under these broader themes so you can see how they sort of relate better to each other. Next slide. So that's what we did. We took all these sort of sub themes which we started with and put them in these kind of four broader main top level themes, and started looking at this dendrogram sort of layout, which is kind of this kind of network layout, as you're showing you kind of hierarchies, basically hierarchies of this information. Next slide. And this is where we did some of the work and some of the prototyping and all the initial kind of visualization. This is a tool, and I'd strongly recommend you taking note of this. If particularly charities, if you're on a limited budget, rawgrass.io is a free resource, design resource, data visualization resource online, and it's free and open source basically, and it creates static data visualizations, sort of graphics, and it has lots of particularly sort of qualitative and sort of hierarchical sort of data visualizations beyond the standard sort of bar charts and whatever. And they just literally yesterday released version 2.0, which is even better, and it's such a great resource. So if you've got any data visualization graphic design to do, then head there. It's a great, even just mocking up how might my data look, and sort of visualizing it and just trying it out. It's a really nice tool to use. So yeah, so we use that a lot. And then, so when we plugged in all the top level, all the issues directly into this kind of circular dendrogram, this is what we got. And it's like, again, we're back to that kind of sort of hairball kind of looking sort of network. There's a bit more organization there, but again, it's too much information and too detailed, and this sort of circular layout wasn't really working for us because it's not a very efficient use of space in terms of showing text. So next screen. So what we thought about was, okay, we need to zoom in onto one of those branches. So one of those four top categories, one of those is civil society and safety net. What might it look like if we show those a branch at a time, basically, a sort of one of the 4 branches at a time. And so that's what that is showing is and also that this was one of the busier branches. So we're looking at, okay, this is as busy as it gets. So how might that look? And then next screen. And then we're adding some color and some sort of typography to that, and seeing how might that look on screen. Is that readable? Is it accessible? Have we found a balance of being able to zoom in on one section of the data that's actually going to be that you can actually unpick? So the next slide. This is where I got my pens out and my compass out and thought, right, how am I going to arrange these branches around some sort of circular hub or some sort of hub that sort of binds them all together? And so this is where I started working out, okay, how many subsections do I need? How many segments to those hubs do I need? And then the next slide, starting to work that up. So this is where I then take the output from rawgraphs.io, which outputs as an SVG, and bring that into Illustrator to then start sort of laying it out and editing it and sort of annotating it. So quite often, particularly with information design or static data viz, there's a kind of producing the raw kind of visualization, and then bring it in for kind of tweaking and sort of and annotating and those final sort of tweaks. And so the next slide then shows you how might those issues, that one branch look, if it was around one of those hubs, would that work for us? And then the final 2 slides are basically as you've seen it, the final piece with all the kind of the color encoding and the typography and the layout. So yeah, so that's how we got to the design we got to and the tools we used.
Thank you, Mike. That's really, really helpful. Yeah, I mean, I might sort of stop sharing. I was just leaving it on the slide here of the map because I realised we haven't really kind of spent some time just looking at the kind of full map. But yeah, we've got, I think we've got time now really to start to sort of pick up questions from the chat or think about some questions that we have as well in a Jamboard. Kate, I don't know if you had anything sort of particular, or are we okay to just sort of carry that on?
Yes, just go ahead, Olivia.
Okay. Yeah, so I'm going to try and look at the chat. Melissa, I don't know if you have already, and if there's anything.
Yeah, I've been going through and answering some questions. Lots have been coming in around sort of the specific data that we used, and people have been sharing some really great links as well to other events and other data that they've been doing. There were specific questions around how we've engaged with the LGBT plus community, and also some questions around sort of the Somali community and sort of the lack of data and how we've been working with them. And also there was a question around how we've engaged with faith communities. So I don't know if there's any of those that you can pick up on. I've answered some of them in the chat, but if there's anything you can mention maybe around like continuous faith engagement, or if we can put in one.
Yeah, sorry, I haven't had a chance to scan through yet, but just in terms of kind of how we've followed up, I suppose, engagement maybe. So as we said, there was this kind of quite focused period, but then obviously that was kind of really around that lockdown 1 and that kind of earlier phase. And then what started to happen around October and November time in 2020 was us kind of really wanting to reconnect with all of those roundtables attendees and those we engaged with, because we were already starting to look at the lockdown 2 and the multiple different tiers that kept changing as well. And I think what was really interesting in terms of what we were hearing in that kind of follow-up, I suppose, and just to say that follow-up was not in a kind of roundtable setting. We did that more as a kind of one-on-one with specific groups as well. So it was a bit more kind of time sort of pressure, but we thought it was really important to give that space as well. But we were hearing really similar things. It was just an interesting exercise. We weren't sure if there were going to be really specific kind of new issues and insights coming through that we would then think about kind of adding to this map. But actually what we were hearing was the same, but kind of more pronounced, obviously, because we were now kind of much later down the line. So that kind of engagement has has developed. And yeah, just to sort of, I don't think we, just to kind of give a kind of sense of some of those groups that we've talked about. So, you know, there was some new engagement that for the GLA and for the community engagement team, which is really, really exciting. So kind of starting to build relationships with the East and Southeast Asian community in particular as well. But then I guess just around faith, we have a stakeholder team in the GLA who also have really strong relationships and connections. So we had a Sikh focused faith roundtable, a Jewish one. So yeah, there were sort of, as we say, that was a kind of the focus of this particular piece of work.
We've got somebody in the chat who wanted to ask a question. Just scroll up. Kush Kanodia, did you want to say a question?
I just wanted to say that we know that the ONS has recently stated that 3/5 of all COVID-19 deaths, unfortunately, have been disabled people. And you highlighted the gaps in your focus on disabled Londoners. But actually, it's much worse than that. Recently, the High Court actually ruled that the Streetscape initiative of the Mayor of London and Transport of London was unlawful because you didn't take into account the voices of the elderly and disabled, and the equality impact assessment that you did was basically non-existent, basically implying that you'd already made the decision. And I'm really concerned about the ultra low emission zone that's coming in London in October, because you're not providing the same reasonable adjustments for disabled people in London that you do for the congestion zone. For the congestion zone, you provide 2 exemptions for a blue badge holder in London. For the ultra low emission zone, you're providing the exemption if the car is registered disabled. This is going to have another real impact upon disabled people in London, because lots of disabled people may not own cars. They may use cars of friends and family, and it will also impact carers, helpers, and supporters upon London. So you're not just failing to acknowledge and focus on disabled people, you're actually making policies and initiatives that are detrimentally impacting disabled people when you already know the COVID-19 pandemic has disproportionately impacted disabled people. So I really am very concerned about some of the policies and initiatives from the Mayor of London, the GLA and TfL for disabled Londoners.
Hi, thanks, Kush. And unfortunately, we're not from that particular team, so we don't have sort of a really good insight into how those policies came about. But what I can do is, if you let us know your direct email address as well, we can try and put you in touch with someone who can answer your question better, because Olivia and I, it's not our area. And sort of Jeanette's just commented as well, who's the head of our team.
I'm hoping it can be resolved without it being taken to the High Court again. Like, it's ridiculous that we have to enforce our rights in the High Court. So I'm raising it with you for it to be addressed beforehand.
Yeah, so I know that there has already been a roundtable with deaf and disabled people's organisations, and there is another one coming up with Debbie, the Deputy Mayor, this month. But it's not something that Olivia and I are involved with. So I don't really want to give you the wrong information around that. But it's good that, thanks for raising it. We can definitely and Jeanette, as I said, who's our team manager, is in the chat, and she's going to pass on your concerns around that, definitely. We've had another question around deep engagement, listening to people with learning disabilities and their families, carers. So there were lots of groups who came to the roundtables who represented carers or those with learning difficulties. So I didn't do every single roundtable, but one that I can definitely mention is at the Bangladeshi roundtable. There were 2 organisations that represented parents and carers of people with learning difficulties and learning disabilities, and they and we've been in close contact with them ever since, and they've contributed quite a lot to some like broader engagement we're doing around digital exclusion, because of course most people don't think of digital exclusion in that sense. And they've been sharing some really interesting work that they've done around sort of moving their usual classes and events online for families, and how they've adapted, and that's been really useful for us to learn about. See if there's any more questions.
There's one from Karen in there about the geographical spread of the respondees and whether there's a variation between the boroughs.
So we made sure when we were organising the roundtables that we had a really good spread across London, essentially. So that obviously in some cases you can't help it if there just happen to be sort of more groups in West London or East London. But we always when we're engaging with people, we always write that down as something, because we want to make sure that there's a good spread. And yeah, we had sort of representatives from organisations from Barnet, from organisations in sort of Hackney in the city, from West London, Ealing, Harrow. So there was quite a broad spread, yeah, and we made sure that we did that, because obviously people's access to services depends a lot on their locality. But then a lot of issues came up where people represented groups like beyond a borough constituency as well, and how difficult that had made accessing funding. So if they represented sort of groups who lived across 4 boroughs, for example, and they couldn't tap into that specific local authority support. So that's something that we've mentioned in the map as well.
And also, just to build on that, Melissa, there would be services specific to London, but then, there was such a high demand that was also spreading outside of the capital as well. But I just thought it might be interesting around the kind of spread, just to highlight a different piece of work from our team called Community Conversations, which took place around sort of August and September. And I think that was very much inviting community groups to host their own conversations in response to the kind of recovery missions that were being outlined by the GLA. And I thought what was really interesting, just in terms of spread of boroughs, just looking at the data that came back from that, and I think there were around 1,000 people that were kind of engaged through that process. But it was just such an even spread, and it was so interesting just to see that. And I think, as Melissa was saying, like it's kind of, it's always sort of reflected in the work that we do. But I also just wanted to quickly pick up on a question, which I'm not sure how well we can answer, but it's just kind of like a big picture question around, is it Linda, around how we can influence data collection. Agencies are asking all the time about how many people are in the community are affected. I don't know if Linda's on the call and wanted to kind of expand a little bit on that so that we can help answer a bit better. Linda, I think you might be on mute at the moment, but yeah.
Hello, Olivia, and thank you so much for the opportunity to say something. And I hope it does reflect many of the questions that have been raised here. As a member of ethnic minority groups, we find that probably the split of the way data is collected is not fine enough. For example, Somali communities mentioned, etc., etc. And I wonder how we can influence the statistics. I'm particularly concerned at the moment because with the impact of the pandemic, which has affected everyone, the impact that's on the Chinese East and Southeastern communities is the impact of racism against our nurses, our doctors, anyone who's slightly different. I'm a totally equalities campaigner, but I'm just involved in this issue because of the growth. And we're working with the community and with the police to encourage reporting and also to improve mental health. Now, all the agencies says, well, how many of your community are impacted? I've been spending a couple of days trying to get data from the Home Office of reported incidents, and there's nothing there, nothing up to date. And I think what the data collection agencies need to be is more fleet of foot to respond to crises or incidents. Suppose there's something that happens, a terrorist attack, and the one community gets blamed for it with the pandemic. Unfortunately, the Chinese East and Southeastern communities are being blamed for it, and the effect of mental health on our community. Children are worried about going back to school, and we before we can get resources to support any community when adverse incidents happen, whether it's health, crime, schooling, there's no fleet of foot to provide data. So how can we influence that?
Thank you, Linda. That's a really important point to make today, especially, and it's something that's very much on our team's agenda in terms of it's kind of what we've been hearing a lot of. And whilst a lot of those sort of data collection agencies are kind of outside of the remit of our specific work, we know that there is work to do around that. So the intelligence unit actually that Mike is from obviously kind of look at a whole different range of different kind of data sort of collection and analysing as well. And so we've got meetings coming up quite soon with them around how because I mean, we know that connections have been made with specific communities and our intelligence unit team. I think it's probably a bigger question for those actually, as you say, data collection agencies, but it's really high up on our agenda as knowing that it's a priority for communities. I wonder if this is a really important aspect that we need to also think about for, I mentioned earlier, for our Jamboard. So I'm really aware of time. I've suddenly realized it's 5 to 10. So what we thought would be helpful, and there's been a few references about maybe adding links to the Jamboard, which I think is a nice idea. So this same question around influencing data collection could also be added to the Jamboard. So if we add the link in now, it's not necessarily something that we need to do or for you to look at now, but it might be a good link to share in the follow-up, if that's okay, Kate.
Yeah.
And I think what we would really like to do is hear your responses, and that Jamboard link will just be open for people to kind of continue adding kind of comments and thoughts around kind of how we collect data, who we're engaging with as well. And we'll definitely put all of the links that we've talked about today up there. But yeah, I'm just wondering if I know we need to finish bang on 10, so I don't know if we should hand back to you, Kate. Is that?
Yes, I mean, I don't have a lot to say. I am going to drop a link to a short survey into the chat now. I will also forward this via email to everybody that's booked on. And there is a chance there to flag any follow-up data or digital support needs that you have. I'm talking about the small charities and community groups that have joined us this morning. We will respond to that. Linda, there's also a space to for you to flag where you've had issues with data sources, because there might be something that we can follow up with you under DataWise London. I think maybe through MOPAC there might be access to hate crime London data. I'm not sure, but there might be something that we can follow up with you on that. So
I'll certainly feed that back to the intelligence unit as well. I know, Olivia said that she was already having conversations about that, but I'll sort of feed that back into. And I think your point about rapid sort of data gathering as well, because often we're using slower data, ONS data or something like that, and how can we use maybe something like Talk London to rapidly gather data from communities?
Mike, for your information, in Googling the Home Office, there is a section which does mention if there's something that we're not doing quite right or quickly enough, do contact us. So I'll forward you that link, and if I may have your help to help everyone with how to access data, that would be terrific. Thank you very much, and thank you everyone.
Thank you.
Yeah, big huge thank you to everyone for kind of being here and listening, and yeah, it's been great to share this with you.
Cool. And yes, just to recap, we will do a follow-up email. So complete the survey, you'll get access to the slides straight away. We'll share the link to the recording and we'll share some further information about the free training opportunities that are coming up under DataWise London as well. So unless anybody's got any other quick question, I just wanted to say a big thanks to our colleagues from the GLA, to Olivia, Melissa and Mike for joining us this morning.